Hello all, this is Dr. Dheeraj Masapu. For people who don't know me, I'm a neuroanesthesiologist. I give anesthesia for brain surgeries. Today I'm reacting to a video which is released recently in the media. This is about a neurological condition faced by a celebrity, and she is Hailey Beiber. And this is about she getting a mini stroke. In medical terms, it is called as a transient ischemic attack. And I would like to react to this video, and at each stage I would give my and I really appreciate Hailey Beiber for releasing this video. A reason being, if they release such kind of videos, it increases the awareness among common man and general public. And by increasing the awareness, I think they will understand when to reach the hospital and what is the urgency, and also what kind of workup needs to be done. So let us go through the video and discuss more about these during the video.
Hey, it's Hailey, and my voice is a little gone. I'm making this video because I wanted to tell this story in my own words of just where I've been at health-wise for the last month, and kind of what I've gone through and what the story is here. I think, as some people know, a lot of people know, or you may not know, I had a very scary incident on March 10th. Basically, I was sitting at breakfast with my husband, having a normal day, normal conversation, and we were in the middle of talking. And all of a sudden, I felt this really weird sensation that kind of traveled down my arm from my shoulder all the way down to my fingertips. And it made my fingertips feel really numb and weird. And I was sitting there and I was kind of going like this, trying to figure out what the sensation was and where it was coming from. And Justin was like, "Are you okay?" And I just didn't respond because I wasn't sure. And then he asked me again, and when I went to respond, I couldn't speak. The right side of my face started drooping. I couldn't get a sentence out. Everything was coming out not even jumbled, just couldn't get any of the words out. So obviously immediately I thought I was having a stroke, a full-blown stroke. He thought I was having a stroke, so right away he asked for somebody to please call 911 and get a doctor. Where we were, there happened to be a doctor there, a medic there, who rushed over, and they started.
So if you have watched till now, what she's telling is a typical presentation of a stroke. So if you think that you are young and why will a young man get a stroke or a young woman get a stroke, then you're mistaken, because there is a 15% chance of young people getting stroke according to statistics. So be aware. So among the total strokes, 15% are happening in the young people, mind you. So that's because of several reasons, because of the lifestyle, smoking, alcohol, obesity, and sedentary lifestyle. So many things are there. So, but how to identify that is by neurological symptoms, or focal neurological symptoms, what we call. So the first things that appear would be tingling and numbness, which comes in your hand and feet. And also there will be, in some patients, if it is involving the left side, you might have a speech problem also. You'll be unable to talk. So that is what she's trying to tell you. I think she would have got on the left side. If it is on the right side, then the speech will be totally normal, and you'll purely present with numbness and unable to move your left side of the body. So that is one kind of presentation, and some kind of strokes also present with visual disturbances. Let us not go into the details of that. So what we need to understand here is one thing is that it can happen in young. So don't waste the time trying to think that you're not getting the stroke. Quickly call the ambulance. That is what they have done. They have done a very good job here. They immediately called the ambulance without wasting any time, and then they got the medical service done. Let's continue with the video and see what is going to come now.
Asking me questions, they started testing my arms. Definitely the scariest moment of my life. I had so many things running through my head. The number one thing being, I'm having a stroke. I'm really scared. I don't know what's going on. I don't know why this is happening. Am I going to have permanent issues from this? Like, so many things were running through my head that were really freaking me out and really, really, really scaring me. The facial drooping lasted for probably like 30 seconds, maybe a little bit more. I couldn't see myself, of course, so I don't really know, but I do know that it like subsided fairly fast. And so they were asking me questions and, do you know where you are? Do you know your name? And I knew all of the...
So she mentioned something about facial drooping, that is called as a facial palsy, which develops during the stroke in some people. Even that is a sign where you need to catch and attend the hospital immediately. So usually what happens is in facial palsy, which is caused by stroke, usually the lower half of the face is involved. The upper half of the face is usually spared. So that is called as a human type of facial palsy. Let's not go into the details of those things. But so facial palsy itself is also a kind of a symptom that you need to catch in the initial parts. So that is what she is telling.
Answers in my head, but as soon as I would try to say it, I just could not get it out. It was like my tongue and my mouth just could not form the sentences and the responses. So obviously that was really, really scary. So I got up. I could walk totally fine. At that point, it was really just like the speech issue. Went back to my house, waited for the ambulance to come. At that point, speech started to come back a little bit. Got in the ambulance to the hospital. There was actually a funny moment where they were calling into the hospital to explain what they were bringing in, and they were like, I have a 30-year-old female, and I was like, I'm 25. I had to make sure that they weren't going to age me 5 years for no reason, you know? And I noticed that when the speech came back and I felt like I could talk, as soon as my anxiety would like settle in or hit me, it would make my speech feel funny again. When I started feeling really scared and really anxious, it just made everything worse. But by the time I got to the emergency room, I was...
Here, another important thing she's trying to tell, that is the reversal of the speech. So initially, she lost the speech for some time, but now it is reversed. So that is a diagnostic criteria for transient ischemic attacks. So how you differentiate stroke and transient ischemic attack is a mini stroke or a transient ischemic attack will usually resolve. According to definition, within an hour or 24 hours it needs to resolve. But permanent stroke will not resolve. That is the main difference. But now the definitions of transient ischemic attack are shifting now from time-based definitions to tissue-based definitions according to newer AHA guidelines. So what they are saying is you need to do imaging immediately, and then even in the imaging you need to go for a diffusion weighted imaging, which is one of the sequence in MRI. In the diffusion weighted imaging, we can clearly make out whether it's a stroke or a transient ischemic attack. If it is a transient ischemic attack, you're not supposed to see any changes in the DW sequences. So if you're seeing a change there, then it goes in favor of the stroke, so which will have long-term implications. And transient ischemic attack usually resolves. So that is how we differentiate between both the conditions.
Pretty much back to normal, could talk, wasn't having any issues with my face or my arm. They did like the stroke checklist in the emergency room and I scored a 0. I wasn't having any symptoms anymore. So basically, they did some scans and they were able to see that I had suffered a small blood clot to my brain, which they labeled and categorized as something called a TIA. I'm going to try to put the definitions of everything I talk about under here so that I don't butcher it. Basically, it's like having a mini stroke. It definitely feels like having a stroke, except my body was able to resolve it pretty quickly, and then I didn't have any more issues for the whole rest of the day and the whole rest of the time that I was in the hospital. I felt really thankful and grateful for that it wasn't worse. I wasn't gonna have any permanent issues, but my scans did show that I had a lack of oxygen to a certain part of my brain for a certain amount of time. Still definitely really, really scary. So when I was in the emergency room, they kept me overnight. They did tons of tests. They did blood tests to see if I had a clotting disorder or if I had an autoimmune disease, or they did everything. And anything that they could think of, they did. They also did a certain test called a bubble echo, which is when they do an echo on your heart and they take saline and they kind of, I don't want to say shake it up, but they make it so it has bubbles in it, and then they put the bubbles in your vein to see if you have any bubbles escaping out of any part of your heart. And what they're looking for in that test is something called a PFO. Basically, what a PFO is something that you are born with, and typically at birth it's supposed to close on its own, except sometimes it does not. And it's a flap that's kind of like this between the right and the left chambers of the heart. So when I was in the emergency room, they did this test, they didn't see anything. They told me that I didn't have a PFO. So the next day I was discharged and I went to...
So now what she's trying to tell is, so now they established the diagnosis of transient ischemic attack or Ministroke. So next step would be to find the cause. So they are in the process of finding the cause. So what she is trying to tell the bubble echo is that they inject agitated saline or saline with bubbles into your blood circulation, and when it reaches your heart, if there is a communication between your right and left sides of the heart, which normally doesn't exist, in some people called as a patent foramen oval, there will be some communication. These bubbles will pass from right side of the heart to the left side of the heart, which can be seen in the echo. So that is what is called as a bubble echo, which is a diagnostic test for PFO. But the better test and more sensitive and specific is the transesophageal echo, which is being done now very commonly. But in awake patients, it is a little tougher to do because you need to send a thick probe into your mouth and it should go into the esophagus. So that needs some amount of sedation. And in a person who has suffered already a stroke, again putting them through a kind of sedation and anesthesia is slightly risky. So that is why I think they are trying to go for this kind of bubble echo and other things.
Down to UCLA to see some more doctors, to do some more thorough in-depth testing, because at that point they didn't really have an answer or a conclusion for why this had happened. They did come to the conclusion of why they think I had a blood clot in the first place. And the conclusion that all of the doctors came to was three different things. One was that I had just recently started birth control pills, which I should have never been on because I am somebody who suffered from migraines anyway, and I just did not talk to my doctor about this. So ladies, if you suffer from bad migraines and you plan on being on birth control pills, make sure you tell your doctor, because having a stroke is a potential side effect from birth control pills. The second thing was I had recently had COVID, and that was something that they thought was a contributing factor. And then the third thing was that I had recently gone on a really long flight. I had flown to Paris and back in a very short amount of time. And I slept through the whole flight both ways, didn't get up and move around, never thought about where...